Hello, this is Nephi Jones with Bellevue University. This is Anatomy and Physiology for instructor Robbie Lane. Today we're going to go over the bones of the body. We're going to name them and point out which ones they are. We're going to start with the head bones and work our way down the skeleton. So with our head bones, we're going to start with the frontal, is our forehead. This bone makes up the frontal. We also have on either side of the head, and the top portion is the parietal. On the back side of the head is the occipital bone. The sides of our head make up the temporal, which connect to the zygomatic bones. The upper portion of our teeth, this bone is the maxilla. Underneath, you can't see it on the skeleton, but there's a bone underneath at the base of the mouth is the hyoid bone. Next, we're going to move down the spinal column. We'll see the first 7 vertebrae are called the cervical spine. And if you count down 1, 2, 3, 4, 5, this would be called C5 or cervical 5. So there's 7 vertebrae in the cervical spine. 1, 2, 3, 4, 5, 6, 7. Next we have the next 12 are the thoracic spine. Will be 1, 2, T1 starts here, and we'll go down 1, 2, 3, 4, 5, 6, 7, 8 to thoracic number 8. We continue down 9, 10, 11, 12. This is the end of the thoracic vertebrae. And we start the lumbar, which is made up of 5 vertebrae. 1, 2, 3, 4, 5 is our lumbar, our last non-fused vertebrae in the vertebral column. Then we have the sacrum, and down here, these last fused vertebrae, there's 3 to 5 of them, makes up the coccyx, or what we call our tailbone. These processes on the side are called the vertebral transverse processes. Next, we're going to look at the chest, the bones of the chest. First, we'll look at the sternum, which is made up of the manubrium. It has the sternal body and the xiphoid process. Connected to that up here are the clavicle on either side. Clavicle attached to the acromion of the scapula. There are 3 different kinds of ribs. We have true ribs, which are our first 7, because they attach to both the vertebral column and the sternum. Then we have 8, 9, and 10 are false ribs, because they do not attach directly to the sternum, but attach to it via the 7th rib. And we also have ribs 11 and 12, which do not attach to any of the other ribs except for their vertebral processes. These are called the floating ribs. 8, 9, and 10 are false ribs, and the rest are our true ribs. On, I think it's the top portion, on the sides, there is a bony process called the rib tubercle. The top part of the manubrium is what we call the jugular notch. Next, we will move on to the arms, are made up of the humerus, the radius, and the ulna. The humerus connects to the forearm bones through the olecranon process, which is this kind of cup-shaped process on the ulna. The forearm attaches to the hand got the carpal bones, then we have our metacarpals and our phalanges. Our ring finger would be our fourth metacarpal that attaches to the carpals and then to the phalanges. On the right bone, we'll look at the third finger. The proximal interphalangeal joint connects between the phalanges and the metacarpal. If we look at the carpal bones, the most common fractured one is the scaphoid. When we fall straight down, the pressure exerted usually breaks the scaphoid. Next we'll look at the pelvis. We'll first look at the pubic symphysis, is the articulation point between the two halves of the pelvic, the hips, where the femur connects to the hip. That is called the acetabulum. We have the iliac crest. On the posterior surface is the iliac spine. If we take a look, we move him off of here. The hollow region in between the two hips, this is called the pelvic inlet. These two hollow openings are the obturator foramen. Then we move down from the hips, we have the femur bone, which connects to the hip. It's a ball and joint socket, ball and socket joint. The ball is called the head. This rough bony protrusion at the top of the femur is the greater femoral trochanter. The area between the shaft of the femur, the diaphysis, and the head is known as the femoral neck. We'll move down the femur, and on the lateral sides we have the lateral epicondyle process. On top of the femur is the patella, which is our kneecap. As we move down the leg farther, we have the tibia and the fibula. The fibula is the smaller bone. They connect to the tarsus of the ankle bones, the heel bone or the calcaneus. Like the hands, we have the metatarsals, tarsals, and phalanges of the feet. The third metatarsal is 2 over from the big toe. So it would be our third toe, starting with the big toe. Our first DIP is the connection between the metatarsal and the phalanges. That is some of the bones in our body. It's not completely all of them. And our next video will be the muscles that make up our bones and joints and make us move.